Let's talk first about history. Cardiogenic shock is caused by reduced pump function of the heart. We need to be thinking about things that might cause that, like a history of heart disease or new onset chest pain. Cardiogenic shock can cause pulmonary edema, which can cause shortness of breath. Sometimes patients will also complain of swelling in the legs. Hypovolemic shock is caused by reduced circulating blood volume, which reduces preload. Here, we need to be mindful of a history of blood or fluid loss or inadequate fluid intake. In cases of GI disorders, there is often fluid loss and inadequate intake due to symptoms like nausea and vomiting. Distributive shock is caused by a handful of unrelated shock conditions that all lead to inappropriate dilation of arteries and veins. Dilation of arteries results in reduced afterload, which drops the patient's blood pressure. History of infection, allergic exposure, spinal injury, corticosteroid use, and other findings suggestive of adrenal insufficiency should invoke distributive shock. Extracardiac obstructive shock is also caused by a handful of completely unrelated things, which we will discuss in detail later. Here, a history of valvular heart disease, risk of thrombosis or hypercoagulability, risk for development of a pericardial effusion, and risk of pneumothorax are important. Click the hospital icon at the right to return to the hub to learn about other diagnostic modalities.